So this presentation is going to cover the Dean Hayden Resident Research and Evidence-Based Practice Grant. We will discuss research, evidence-based practice, and quality improvement. When you look at the Dean Hayden Research Grant application, you'll notice that there are two distinctly separate sections for the application for you to fill out. One section is for research, and the other section is combined for both evidence-based practice and quality improvement. It is important to note that a literature review alone does not qualify for the Dean Hayden Research Grant. For an evidence-based project or quality improvement project that does not include implementation, so you haven't actually done it yet, there must be a plan for project implementation and analysis articulated in the methods section. So do not forget to include your future plan for the methods, or your grant proposal won't be reviewed. The description doesn't have to be very long, but you do have to describe that you're actually going to do something and implement it. So as you complete your application online, there are specific character limitations for each section that you fill out. These character limits are character limits and not word limits. So even empty spaces will count towards the limit. Each section, you can see these limits at the beginning of the section. So when you start completing the application, you'll know. You will need to be clear and concise with your narratives. You don't have to feel like you have to fill out the entire character limit that is available to you. What is important is that you keep it simple, clearly describe what it is you're doing, and describe your research, your evidence-based practice, or quality improvement initiatives. So don't feel like you have to use all the available characters. So you can read through these objectives. I will cover research, evidence-based practice, and quality improvement projects in separate sections in this PowerPoint presentation. Note that when you complete your application online, that research is in its own category separate from evidence-based practice and quality improvement. So those two are grouped together. This is important because the application uses branch chain logic. So if you choose research up front, it is not going to give you the options you need to fill out for the other two categories, because those will be hidden from you. And vice versa, if you choose the quality improvement one, it will not show you what you need to enter in for research. And I will also cover some common mistakes and some pointers for making your application to be more competitive. So the very first part of this presentation, I'm going to go over the basic concepts to help you fill out the grant, and for the different sections to describe what's supposed to be in there. And then after that, towards the end of the presentation, I'll provide more tips on writing a successful introduction and methods section. So the Dean Hayden Resident Research and Evidence-Based Practice Grant is awarded up to a total of $5,000, and it's open to AANA resident members meeting the following criteria: that you must be in good standing academically with your school, and to prove this, you'll need to include a letter of support that must be completed by either your program administrator or whoever your research advisor happens to be. CRNAs are not eligible for this grant. The Dean Hayden Grant has only two categories to select from when you apply. It is either research or non-research. The research includes the quantitative or qualitative research. The non-research category, that's the evidence-based practice and quality improvement. So be sure you select the right category to go through. And I will discuss these in the next several PowerPoints. So here's a list of documentation required when you submit your application. You will need to submit your references in APA format and not AMA. You will also only include your references in the section of the application that specifically states for you to include the references. So there's only one area to put those. And don't include references in other sections that do not ask for them. There's only one field in the application that is intended for references. Be sure you read through this entire list of things that are required. Some of them may not apply to you, such as maybe the survey tool or other instruments if you're not going to give some type of survey. Also, when you do your budget, be sure to include the justification for expenses. It won't be enough for you to actually just list the expenses. You'll have to have some type of explanation of why you need it, how you're going to use it in your particular project. Also, no tables or figures are allowed. The way the information when you do the application is going to be digitally online, and there's going to be no way for you to copy and paste any type of table or figure. So the first category of the grant application is research, which includes both quantitative and qualitative. The online application portal has branch chain logic, which will send you to the appropriate data entry options based on what you enter at the beginning. So the quantitative research, that is the most common category for students. It deals with numerical data with some type of measurement that's used to quantify some concept. There's always some statistical analysis involved in it, and at the very minimum, there's descriptive statistics provided. So a common approach for students is to some type of pre-post survey or other measurements, and it's often analyzed using t-test or other similar statistical tests. The qualitative research, that is less common for most students who are non-PhD. It covers the understanding of abstract concepts or lived experiences of people. So it's much more looking at concepts. It doesn't quantify anything numerically. So DNP students doing qualitative research usually involve some form of interviews or surveys where they're looking at the responses themselves. So this table does a great job defining the properties of quantitative and qualitative research. Quantitative is quantifiable with numerical data that can be processed, usually with software like Excel or SPSS. There are other programs that can be used also. These can be structured surveys, such as Likert scale questions, where you're asking for a numerical rating on a continuum, such as least or most, or something similar to that. A key attribute of quantitative research is that it's intended to be generalizable to other settings, as opposed to quality improvement or evidence-based projects, which are not intended to be generalizable beyond the setting that they occurred, such as a quality improvement is usually at a specific clinical site or maybe a health system. It is not usually like throughout an entire state or throughout trying to apply it to other geographical areas of the United States. Qualitative research, on the other hand, it focuses on describing a phenomena. There are many qualitative methods that are beyond the scope of this presentation because they're not normally taught in DNP programs. The unstructured interviews are often the primary methods for our students to do to collect data. The analysis, once you get the data, it's thematic, narrative, or even maybe content analysis. So qualitative research is not generalizable. That is not the goal. It is intended to enhance the understanding of a specific phenomena as opposed to trying to apply the findings to other settings. So when you're trying to decide if your work is evidence-based practice or quality improvement, I want you to focus on this slide and the next one for the basic definitions. Evidence-based practice is the use of the most current evidence to guide clinical decisions. So it looks at the published research. And I would also like to point out that the word best practice does not mean it is what is done at your location or at another physical location. Evidence-based practice involves getting your information directly from the literature, and the goal is to improve patient outcomes using current published evidence. So the key to evidence-based practice is that you're implementing clinical practices, you're changing what people actually do clinically solely by what's published in the literature to help guide you. So, quality improvement is a structured approach that makes changes in patient outcomes and health system performance. A defining feature is that it uses data-driven methods to identify what area needs to be improved, and then changes are implemented based on that. So quality improvement is different from evidence-based practice in that it does not get its intervention or data from published literature. So instead of going to the literature to start with to determine whatever intervention needs to be done, the quality improvement data comes from the location it is done by itself, whether it be a specific hospital, an entire health system. It might be information collected on students themselves in school. Though as a DNP project, there will be a literature review component to a QI project. The difference is that the literature review is not the sole source of data to guide the project's intervention. So this table nicely summarizes the difference between evidence-based practice and quality improvement. These differences will help you identify how your personal project should be classified. The evidence-based practice applies to published literature to guide specific clinical practice. Sometimes published expert opinion is used to guide the decisions when there's no published studies to use. Example of this includes position statements from the ANA on given topics. If there is no published literature, then guidelines from reputable entities can be used for assistance. Examples of a good literature to use in evidence-based practice are systematic reviews, Cochrane reviews, randomized controlled trials, or other similar evidence. Quality improvement, on the other hand, that looks at improving healthcare processes. It does not look at individual patients. And its goal is to improve some aspect of the site of implementation, whether it be at the OR level, the hospital level, or maybe even the hospital systems if there's several in the same. So these could be improving efficiency, patient safety, or improving any type of quality of care that could be chosen. The quality improvement tends to have a more system level view as opposed to a specific patient population. And the Plan, Do, Study, Act is the most common theoretical framework. So if you're using that, it most likely qualifies as quality improvement. So this shows the continuum of evidence-based practice, quality improvement, and research. Sometimes there can be some blurred lines when you're trying to identify which category that you need. So evidence-based practice is based on the previous research and bridges the gap between research and practice. Research by itself, it collects data to generate new knowledge. Evidence-based practice and quality improvement does not generate new knowledge, and it cannot be generalized to other settings. So while quality improvement collects its data from real-world settings, it does not guide itself directly by data that's in publications, which that would be evidence-based practice. And this has been stated several times before, but it's really important to help you decide if you want to do is evidence-based practice or quality improvement. Look at your plans in terms of where you plan to get your information. And then what do you want to do with that information once you get it? Evidence-based practice requires you use evidence from the literature to inform your decision. And so this being a literature review to inform that decision that you want to make. A quality improvement project requires that you gather your information from a specific location. So it could be your hospital, your anesthesia department. It is, to start with, it is not the published literature. Your data for making decisions comes from patient care, not outside of whatever setting you're in. You might do a literature search to start with, but it's not the primary determinant of your results, and it is not the primary source of the data that you're going to get to process. Evidence-based practice guides decision-making about patient care, and quality improvement is changing some process about patient care. So an evidence-based project or a quality improvement project is not generalizable to other settings since it is focused on a single setting. Trying to generalize these things might result in a evidence-based practice or quality improvement project being categorized as research, which it is not. I will not go into all the specifics of why it is not generalizable, but there are a lot of things you have to do in research to make it so that you can take what you have at your location and try to say, you know what, this might work at the hospital on the other side of the United States, or maybe we could take this and use it in a different patient population. There are a lot of things you have to do when you write it up to help do that. So in the application online, once you get to the section to do the introduction and methods, I will cover how to write the introductions and methods for the research. And the requirements for a good research introduction and method section is completely different than the evidence-based project or quality improvement project. So you can skip forward to the appropriate section in this presentation if you need the EBP or the QI as opposed to the research, since this will not apply directly to you. Once again, if you select the wrong category, research versus non-research at the beginning when you're starting that, it uses branching logic. So the online application will not take you to the sections you need to do. So if you're going through trying to enter in your information and it's not giving you the options you need, it's probably because you selected the wrong category of research or non-research. So for the introduction section, be sure to pay attention to how many characters you get for each section. You don't have to use up the entire space. You just want to state what you're doing as simply as possible so that it makes sure that it's easy for people to understand. It would help when you write it. Have someone, a friend or somebody, read it to see if they can understand it, because they should be able to read through it and be able to tell exactly what it is you plan to do. So first, you want to engage the reader. You want to establish a clear description of your subject and the context of why that subject actually matters. Why should they care? How does it impact patients? To do this, you can include any statistics identified in the literature or reliable organizations. A lot of times you might be able to get information directly from whatever site you're at, assuming it's not research. Some other sources, you might be able to get some information on mortality rates from the CDC or some other established, respected organization. You can also even mention financial impact. How much does it cost annually for the US or for any location? So there are a lot of different ways you can actually state your topic, why it's important, and why should anyone care. After somebody reads it, they should know exactly what you're doing, and they should realize, hey, this is important. So the next step after you do your topic and the significance and why it's important, you want to do a quick description of background information. You don't want to do a in-depth one that's a full literature review. You just want to state the purpose. And often this is done by creating a sentence towards the ends of the introduction that starts off something similar to the purpose of this study is to, and then just clearly as possible say what it is you actually plan on doing. There's no need to make it sound more academic. This includes the overall purpose, and it's not the same as a specific aim or a research question. The introduction provides a rationale for the study. It is explaining why the research is necessary, why it needs to be done, and how will it contribute to the existing body of knowledge. I believe there's actually a section in the application where you have to clearly describe how it contributes to the existing body of knowledge. So this section is very important because when your grant is being evaluated, they're going to want to know what you're doing and why it's important. So read through these because these are key points you need to consider when you write up your introduction for research. There are often missed pieces of information that are critical to a successful grant. So when you read through these are things that need to be in the grant to explain it. Part of it, if you're doing qualitative research, be sure to include some type of theoretical framework that you're going to use to inform the study. That's very important when you're looking at qualitative research about how what lens you're going to interpret your findings in. Also, when you look at your research question and what you're doing, make sure that it's actually aligned with the title and background. A lot of times a mistake is that they'll talk about a topic and the significance, but then they'll have a research question that really isn't directly related to that information, and that will not create a strong application. So you have to very clearly explain, this is my topic and this is why it's important. Even to the first one there, the significance of the problem or phenomena needs to be clearly identified. It's not enough that it's something that's not known. You'll have to describe why do we need to know it. There may be a gap in the literature, but just because there's a gap doesn't mean that gap needs to be filled. So if you want to fill that gap, you also need to explain why you need to do that. So coming up with a research question is very important. A research question is a clear, focused, and concise question that guides a research study. It defines the scope of the investigation, and it also helps determine the direction of the research. The research question serves as the foundation for the entire study, and it shapes the methodology of what you do, and it also changes the data collection and analysis. All of those things should be related. So the research question must be related to your topic. It's going to have to be related to your purpose statement of what you say you're going to do. And the way you collect data also is determined by your research question. The way you interpret your findings will be determined by the research question. So by the end of the study, when you do it, you should be able to look at your research question and then the findings and be able to clearly say, yes, I did answer that research question. So the research question needs to be clear. So it needs to be easily understood. And so you want to be precise, and you also don't want to be vague. Another key problem most students do is make the research question way more complicated than it actually needs to be. The research question needs to be focused. It has to be specific enough to guide the research without being too broad or too narrow. If it's too broad, it will require a project that is way bigger than it needs to be. So for the significance, you need to be sure that it addresses an important issue and has potential impact on the field. And you also need to make sure that your research question, when you come up with it, be sure that it's actually researchable. Can you actually measure the things in it? Can you use some type of empirical testing once you do find it to analyze it? So a strong research question lays the foundation for a successful study. And so it is one of the big components that is looked at when you do the grant. The well-crafted research question provides a clear, focused study. So these are the components of a research question. When you're coming up with a research question, the specific measurement tools or psychometric instruments are not normally mentioned, such as Maslach's burnout inventory. That's a survey. And when you're doing the research question that measures occupational burnout, you would mention occupational burnout in the research question, but you would not name the tool that you would use. So when you're looking at most research questions, it usually is composed of a topic, a population, and a setting. So the topic might, for one example, might be enhanced recovery after surgery, ERAS protocol. The population itself, you might say maybe adults or peds, and then the setting may be bowel surgeries, cardiac, orthopedic. There are a lot of ways you can do it, but it's good to consider this for the topic, population, setting to make sure that you include everything in it. So I wanted to provide some examples of research questions, and I'll also provide some examples of QI and EVP later on. In these examples, you would need to be more specific in the interventions you want to study. Research questions need to clearly identify your subject and your population. They need to also identify your interventions that will be in your study so that after reading it, people will know what it is you're actually planning on doing. Your research question needs to reflect the actual content in your introduction. A common mistake is creating an introduction and even a method section where you're describing what you're doing, but it doesn't mention the subject, population, or the setting of your research question at all. What you mention in the introduction and the importance, and the purpose, and the research question, those need to reflect what's in the methods and throughout the entire paper. It's also a common mistake to create an introduction or method section that includes content not related to your research question that you plan on going over. It's easy to get off topic because you found something interesting in the literature, but be sure to not go off topic. What you use to measure your variables must be logically related to your research question. For example, if your research question wants to measure pain, do not use a survey that measures anxiety in your study. You'll want something that is specific to pain. And I'll discuss this a little bit more in the methods section. So these are two examples of research questions related to pain management. I included these as possible examples. This is just to give you some idea of how to form research questions. There are a lot of ways that this can be done, so don't feel like you're stuck to this particular example. So note that all the elements in each question, research questions can take many different forms. So here you can see the different elements of a method section. You could read through them. Those are the things that need to be included in the application. For the research design, it may be something like a randomized controlled trial, or what's more common usually is an observational study. That's where you're only measuring what is present with no manipulation of the intervention. So you're also not comparing the intervention to no intervention or to another intervention. So you're just basically measuring what's present without doing anything to it. The most common designs are pre-post designs. With these, when you describe them, you want to describe exactly what you do in the pre-group. What does this group get? Describe any training they get. Did you give them a survey? What did you ask them to do? And in that, just clearly describe it. You don't have to make it very academic and long. Don't get hung up on coming up with a title for your study design, such as pre-post or whatever. It's most important is for you to be able to describe what it is that you do, so that after the grant reviewer looks at it, they know exactly what you plan on doing with your study and what you want to look at and what you hope to find out. So a very common mistake is poorly describing your methods in terms of what it is you're actually doing. Especially the statistical analysis is often overlooked. How will you analyze your specific data? Many grants that are submitted simply state the data will be analyzed. That's very vague and it doesn't really say anything at all. How will it be analyzed? How are you going to measure your variables? That needs to be clearly included in there. And then which variables will be used in the statistical tests? Because you can name the variables, but if all you say is you're going to do a statistical test, that really doesn't tell us how you're going to analyze your data. The variables in your method section, they must be mentioned in the previous introduction section. You don't want to come up with a new concept or topic halfway through. Everything you're looking at should be named earlier in the introduction. For the materials and instrumentation, you need to clearly describe these. You have to submit a copy of the surveys you're using. The content of your survey needs to be congruent with what you already said in your introduction and research question. You don't want to be asking off-topic questions, and you want to be sure that what you are asking will actually help you answer your research question. So that the content of your survey needs to be congruent with the introduction and the research question, and the common mistake being that collecting data on topics you never mentioned previously, or data that you're collecting can't actually be used to answer the research question that you have. So here I've listed the different design types just to give you a description. The prospective just means that you do something at one point in time, and then all of your data that you collected are after that specific moment. Maybe you've implemented a new protocol, and then after that you collect your data. Retrospective, that means it's stuff that's already happened, and this is a very common one for students to use because they're pulling data usually out of an electronic health record, so that they're taking data that already exists and analyzing it. And then for the next one, observational data, that basically means that you have data and it's just what was there. You didn't do anything to change it. You did not do any type of intervention. You may, very similar to, you could do the electronic health record review and get information from that. Now, the difference between quasi-experimental versus a randomized controlled trial, you're not always able to manipulate your intervention so that you could have one group, I'm going to give this intervention, and this other group, I'm either going to give nothing and compare, or possibly it's two different interventions in the different groups. If you can't randomize it, usually it's because it's unethical that you can't withhold life-saving treatment. So if you're looking at something that has the potential to save life or to harm a patient, you can't have a group not getting that treatment. So in that case, that's called quasi-experimental because you can't divide them into different groups to compare. As opposed to the RCT, the randomized controlled trial, that's where you could take one group and put them in the intervention and then possibly compare them to no intervention, or you could take and compare them to one intervention compared to whatever the standard of care is for that particular one. Such as maybe if you're looking at a new drug for pain, that you could have one intervention for the new drug and the other one will be for the default, whether the standard of what is given at that place, whether it be fentanyl or morphine. And then a difference between cross-sectional and longitudinal. That's pretty simple. Cross-sectional, that's just one section in time. So this is the most common for this application. The cross-sectional being you give somebody a survey at one point in time. And then longitudinal would be you've given a survey at multiple points, whether it's like at time X, you do an intervention and do another one. That could be considered longitudinal. A lot of times, though, longitudinal is like multiple periods of times where you've collected data on a patient. Maybe it was a congestive heart failure patient over time. And so these are just some of the basic terminology. Like I said, I don't want you to get lost in picking the right terminology as much as doing a good job explaining what it is you're actually doing. That's more important than being able to put a label on it like this. So for the different types of qualitative studies that are most likely to be done for this grant application, the students will usually case studies or focus groups or where they live, where they're trying to define some concept or something unique about the location, uses the narrative format. These others on there, like the phenomenology, narrative research, grounded theory, and ethnography, those are all advanced, and so they're not very likely for you to be using these. Okay, so a little bit more on study variables. You need to be sure when you pick them that it's something that can actually be measured and measured in such a way that you can analyze it, because for most of you, it's going to be quantitative. So you'll be able to measure it so that you can do a statistical analysis as opposed to it being qualitative, where it's going to be a completely different type of assessment. So some of the common mistakes is mentioning or adding variables that were never mentioned before in the introduction. It may be some concept. And then also a very common one is picking a measurement, a variable that doesn't really relate to your research question. It doesn't answer it and doesn't measure it fully. So it's going to be very important when you do in the variable section, describe specifically what it is you plan to measure. So that way the reviewer, when they're looking at it, they can see that, yes, this will answer the research question, and then looking at the statistical analysis that you can actually analyze that with statistics. So now this section starts the non-research part of this presentation. So this is what you'll need for the evidence-based practice and the quality improvement. Said the evidence-based practice, you take the evidence that's published in the literature and you try to implement it into a clinical setting. So under the examples there, you can read those. Those are all of the different types of EBP that you can use. So this information on your sample, this could also apply to the research section. Your sample are the participants that you actually have access to so that you can include them in your project. And then the generalizability, if you were referring to a study, would be using a random sampling of people, which is usually not possible. In evidence-based practice and quality improvement, it is almost always a convenient sample, especially for the quality improvement where you're looking at data from one specific location. The convenience sample is just simply what it says. It's the people you have quick access to. That may be like if you're sitting in the anesthesia break room and you talk to the people around you to get some information. That's convenience. Okay. So for your materials and instrumentation section, the most common ones that students use are the surveys and retrospective data, where there's data that already exists that they collect. So with your surveys, you need to clearly describe how did you develop them. Did you have information that you get from the site, from the supervisor who gave you the information? Did you come up with the survey by the questions that you wanted to answer yourself? Or was that survey something that was already pre-existing, such as the Maslach's burnout inventory? Then you could also look at, was this previously used on CRNAs or whatever particular population that they were looking at? And just quickly, the terminology, face validity, just basically when you're looking at it, it seems to measure what it claims to measure. And content validity, when you're looking at it, does it contain the information that it claims that it addresses? And then the retrospective data, that is usually the electronic health record data that's pulled by the IT department usually, and then given to the student for them to use. When you're doing retrospective data, some things you need to consider is what is your source? And then the time frame, how far back are you going? Most of the time it's 3 months or 6 months. It's very rarely more than that because it doesn't need to cover years. Like I said, all surveys or instruments that you use need to be included in the grant and a good description of the variables and how you plan on actually measuring something. So for the data analysis section, I'm not going to go over every single type of statistical test that you can use. I'm just going to mention the basic ones. Almost everyone is going to include descriptive statistics of some type, whether you include the number of people in a group or the percentage. You see there are some examples, the sex, the BMI, years of experience. Those are things that you can do descriptive statistics, what would be like the mean, the average, and then the standard deviation. And then you could report those for all of them. And depending on the projects, you might report medians and interquartile ranges, but at the very minimum, it's usually mean and standard deviations. And as far as the analytic part, that's where you're going to take your variables and how are you actually going to analyze them. A lot of times, if you're doing like an association, the first one there, correlation, that's comparing two different variables. It's a Pearson R. And then if you're comparing different groups, it's some type of t-test, or if you're trying to predict something, you'll do some type of regression. To determine which you're going to use, just get with whoever your advisor is and get them to help determine what it is you're going to be doing in your plan. You don't have to have a super in-depth plan for your statistical analysis, but you have to have something, and what you have has to be related to the variables and for the other things that you have in your data set. It will not be enough to say we will analyze the data, which is one of the most common mistakes. There needs to be something in there. The analysis might be 2 or 3 sentences at the most. So on this particular one, I'll let you read through the better version where it has the longer, better description. One of the most common mistakes in filling out this grant application is giving very little information to understand how the study was actually done. For example, there's a huge difference between saying data were collected using surveys. If that's all you say, it's very vague, and so there's no idea what you actually did. You just collected surveys. You don't know what the surveys were or what time periods that you collected them. The other one being data were collected or will be collected. That needs to include what data is going to be collected and how. So you can read through there through the better version that is more in depth and would be more likely to be a successful grant application. So what we see are a lot of grant applications that have inconsistent terminology, and that helps make it so it's not very clear to understand. You need to make it brief, and then the clarity so that when you go through and read it, you can tell exactly what happened. When you're using terminology and you have a term, stick with that. If you're talking about occupational burnout, stick with occupational burnout. Don't switch with burnout or any other term for that. That makes it so it's hard to tell if you're actually talking about the same thing or not. Some other examples here you can see, CRNA, nurse anesthetist, nurse anesthesiologist. It doesn't matter which term you use, just pick one and stick with it. And you can see some other examples there, especially with the abbreviations. Don't keep jumping around. So another common mistake is the ambiguous sample description. so that you need to clearly define what your sample size is and your selection criteria. Because if you're doing a study and you don't say how many people you're going to use, and it's a type of study that they would expect maybe a couple of hundred people to be in, they're going to want to know exactly how many people are going to be in there. So if what you said was we recruited participants from the community, that is extremely vague and it doesn't really tell what. The other one there, a total of 150 participants from the local community, and the inclusion criteria included ages 18 to 65 who've been diagnosed with type 2 diabetes. That gives you a much better understanding of what it is that for the sample. So the setting being the local community center and the sample being the people with type 2 diabetes. And this is going over the lack of details in the statistical analysis plan because this is one of the top things that we see where it's not done quite as well. So instead of saying just data will be analyzed statistically, under here where it says better version is an example. Data was analyzed using SPSS version 26. And when you do cite SPSS, you can go to their site. Each version, they actually have a specific way they like to be cited. And the rest, for what you're going to plan to do, descriptive statistics will be computed to summarize participant characteristics, and a paired t-test will be conducted to compare pre and post-intervention scores with a significance level set at p less than 0.05. So you can see in this particular one, I believe that may be 2 sentences, and that is for a lot of the projects to be submitted here for this grant, that will suffice for your explanation of your statistical analysis. Also be sure that in the analysis here, that what you say you're going to analyze and the different elements, that they're actually congruent with the introduction and the variables that you use to measure. So this, again, is another example of something that is usually not done well in the grant applications, so that you need to be sure that what you pick for your outcome variable needs to reflect with what the purpose is for your, whether it was a study, a EBP, or QI, it needs to be reflected. And that when you're done, you should be able to take the outcome and decide, yes, I did answer the research question and the purpose of this particular project. It is going to be very important before you submit this. Very common issue is lack of clarity and flow of ideas, that once some reviewer reads through everything, they're not really sure what it is you plan on doing. You may be talking about a few concepts in the introduction that aren't measured and reflected in the methods section, or you might use a jargon that they don't understand. So the best thing you can do to help with this is after you're done writing, actually get somebody to look it over, whether that be your advisor or another student. You need to have them look at it to see if they can tell what it is you actually plan on doing. Because a very common thing we'll read through and then we're not really sure what it is for whatever section we're reading at the time. So keep it simple, and also don't repeat yourself multiple times. If you've said something once and you did a good job explaining it, there's no need, especially in the same section of the application, to keep repeating that. So with this particular grant, it actually forces you to answer whether or not ethical considerations have been addressed, that being IRB approval. So you're not going to be able to forget this, but it is, you need to be sure to mention the ethical approvals and the informed consent. It's also very important, the student cannot determine whether or not it needs to go to IRB. The work needs to go to wherever you're at, whatever school, whatever process they use. It is not acceptable for them or you personally to decide that it's IRB exempt. That is, you have to go through whatever mechanism you have at your school, and they have to tell you that it is exempt. You also have to have the IRB approval before you can actually get any monies awarded to you. So it doesn't matter where you are, IRB approval, you have to have that before you start data collection. So with your project, be sure that you don't actually start collecting information until you have the official. Okay. So for just a quick summary, Make sure your writing makes it easy for someone to identify your topic. Why is it important? What's the significance of it? Why should anybody care that you're doing this project? You want a description of your variables and how they're actually measured. And then make sure the statistical plan is congruent with your variables. Don't pick a statistical plan that can't be used with the type of variables you have. Make sure that everything discussed in the method section and the stats section is congruent with what you mentioned in the introduction. You didn't add a concept that wasn't previously mentioned, and you didn't fail to include something that you mentioned up front and that you never measured in the work. It's very common to read a method section that doesn't relate well with what was discussed as the purpose of the work. If your purpose is to improve adherence to some protocol, be sure that your measurements and statistical plan match that. For example, in this case, do not focus on just user satisfaction in the statistical analysis if your goal was adherence to some type of care. So thanks very much. This was the Dean Hayden Resident Research and Evidence-Based Practice Grant. If you have any questions, please contact this email here, foundation@aana.com.